Hi everybody. I don't know how long it's been since I've done a video. However, I've got a few updates. Number one, this has shrunk a little, I have cover up on, but I did go see a dermatologist who thinks it's skin cancer. But I don't know, he told me to put petroleum jelly, which I was like, what's that? It's Vaseline, and a Band-Aid on every night. So that was like over Memorial Day weekend. It's July. I don't know. It's like the 18th or 19th. Whatevs. What's another update? I'm not hiding in the closet, and I am in my new house, which we moved into like in November. Another thing I want to say, like, I had like where you go in, Dr. D goes in through the eyes and up the forehead. I have like really bad dry eyes, and I've gone like to an eye doctor. I have like these weird they don't have like, because I get like weird like little cysts now, but my neurologist said it has nothing to do with that surgery. I'm just wondering, anybody out there that's watching this who's had that surgery, do you guys have like extreme dry eye? Like I wake up in the morning and I'm like, I feel like I slept with my eyes open. And like there was like air blowing on them, and then I'll have like green crust. I know I'm sexy. Also, I've aged. Yeah, I was like look at my neck. Like, I don't care. But anyway, so there's just, here's the thing. Dr. D has made like a lot of new discoveries, and what he had disclosed to me, which made me feel better, but yet doesn't. I'm like, oh my God, yeah, but that's kind of sad. But yeah, it's good news, is like the longer, like if you've sustained a head injury or the longer you've like suffered, it's like it's almost like the longer your recovery is going to be, or the longer you're going to have like these flare-ups. Or sometimes I don't really know. I'm just like, okay. But I like have longer conversations with my neurologist because I see her every 4 weeks, and I'm always, every time I see Dr. D, I'm just like, I'm fine. Because I don't know, before it was always like, oh, well, you have to have another surgery, so any pain you're feeling, it's because you still have damaged nerves. But this is the main thing I have got to get across, because I get flooded, like I get inundated with emails or phone calls that people are like, I don't want to have 7 surgeries like you, OMG. Listen, again, and I've said this in so many videos, that people are like, this is like that, this has been my case. Like, again, there have been hundreds of people that have gone in and like had a 45-minute decompression, and they have their life back in 2 weeks again. Hate them, jealous. Just kidding, I don't hate anybody. I'm a lover, not a hater. But like, seriously. And then I know a couple people personally too, or I've like communicated with them, that are kind of have had like gone down the same track as me, but again, they've been suffering for years, and their case is complicated, and really like Dr. D has really had to go in and like scrape a lot of like crap out of our head. So it's just I'm sitting here today saying that, and if you go back to my other videos, and I literally just saw family that I haven't seen in a couple of years, and they were like, you look so much better than you did 2 years ago. And that statement it made me feel good, but I was having a bad day that day. But I'm not going to sit there and be like, going and seeing family being like, I don't feel good, because that's not me. I was like, thank you. And they're like, oh, you look, you definitely look so much better than you did 2 years ago. How are you feeling? You look great. And so when people say that to you, you're just like, I'm fine. Because, who wants to be Debbie Downer? But literally, that actually was I don't even know how I made it out to be with the family, because my head was like, it was a really bad flare-up day. And I just like and I don't know if anybody else is like this too, but when you have like really bad days, everyone's like, go lay down. I can't, like when I wake up and it's a bad day, I have to immediately get out of bed, because I don't know, like laying down and having like that, like that numbness kind of feeling, but yet your head has the pressure, like, and also like Dr. D even says like post-op elevate, like I have got to get out of bed. Like I've got to be in like this chair, like my grandparents used to say. I'm like, I don't know, like I can't lay down. And my mom is famous for being like, oh, honey, if you don't feel good, lay down. And mom, I can't. But she finally gets it. Like, she understands. I've explained to her, like, laying down doesn't help. Like, I've got these really awesome gel ice packs. And what's hilarious is, again, people are probably like, how do you ice if your head is numb? It's numb, but it's not. So I even have to put like my 20-minute timer on because I've fallen asleep before, and I'll probably like have to go to the hospital for like ice burns, but it's just feels so good. Like, I don't know, but and they're so soft, and I literally just I have, they come with covers. I could walk downstairs and show them to you, but I'm #lazy, don't want to. They're the best. No, literally. But if anyone's watching this and want to know exactly what they are, just email me through the foundation. I'll give you like the exact what they are. You guys probably already have them. Who am I? I'm like dinosaur ages. I think I'm so cool with like all my like ice packs and pillows, and I'm not. Let's see what else is new. It's been 5 months, and it's still like just one day at a time. Going to physical therapy twice a week, and that's a very slow process. Like, I'm getting the soft tissue massage, which I'm always like, oh, don't stop. And then we're slowly working in like exercise. Well, when I say exercises, you have like that band and you're like laying down and you're like, one, is this going to take away my arm flap? Thanks. Great. Cause I'm like over 40, but, I don't know. It's just, I know I've had moments, and I'm not going to sit here and lie to you and say that I still don't, because I'm human, but I'm so grateful because I'm unbelievably in a better place. I just want to be able to sit here and say, like, the flare-ups are gone and my eyes don't look like death, and but again, like, I don't want to complain. Like, I'm just in such a better place, but yet I just, I don't know what it's like to have like my head feel like just my head, like not to not even think about it. And I guess like I've never been one of those people that like I never took life for granted. I never was like, she never stopped and smelled the roses. I guess the one thing that I did in life was I never realized my head existed. Does that make sense? Like, literally my life revolves around my head. Like, oh my God, what's my pain level? And oh my God, is somebody gonna hit my head? And oh my God, I have anxiety about my head. And it's so weird. It's like so weird. But again, like, I'm so fortunate to be like 20 minutes away from like the best neurologist and the best surgeon, who are seriously like so supportive and have been like my like literally like therapist, and just they've just been great. I'm just checking in, and I just want everybody to know that I'm here for everybody. If you guys are just starting this journey and you're like, I don't want to have surgery, if you are, if it were me, like, I mean, in 2010, when Dr. Juchik said those words, I can help you, I was like, is there an operating, like, are you ready? I'll go right now. Like, there's hope. Like, with these flare-ups, like I said, like, my life today versus what it was in 2010 is unbelievably better. But yet, I still have flare-ups. I still can't do what I used to do. I'm not normal as far as like, I can go to work and I can go to the gym and but it's okay. Like, again, we still don't know. Like, it's been 5 months. Like, I remember my bilateral ON surgery. It took 19 months to the day for that deep pounding in the back of my head to stop, and I keep a daily journal for Maureen, for my neurologist, of like, this is what I did, this is what the pain was at, and this is what the weather was doing, and this is really helpful. And I even go back and I like to see So anyway, this is coming on 10 minutes. Everyone probably already fell asleep. I hope everyone's doing great. Reach out. I'm here. Anybody going in for surgery, you have questions, email, I'll call you. Love to you all. Have a great summer. Bye.